Hello, everyone. I think in the interest of time, we can start our session. May I first take this opportunity to thank you all for attending the inaugural Genomic Sequencing Procurement and Supply Chain Management Committee of Practice. This is a very important session for the African continent, targeted at creating a vibrant platform to strengthen procurement and supply chain in relation to genomic sequencing. Ladies and gentlemen, it is my singular honor and privilege to invite at this moment Dr. Tokmo Maruta, who is the Director of Programs at ASLM, to give his welcome remarks. Shortly after him, Dr. Collins, who is today standing in for Dr. Sophonias, shall be invited to give his welcome remarks on behalf of Africa CDC. So at this moment, allow me to invite Dr. Tokmo Maruta. Over to you.
Thank you very much, Dr. Johnson. And good afternoon, good morning, good evening to you all colleagues. And as already indicated by Dr. Johnson, we warmly welcome you to this first genomic sequencing procurement and supply chain community of practice, which once again is an indication of our commitment as the African Society for Laboratory Medicine, commitment to advancing laboratory systems in Africa. As you know, ASLM, together with many other stakeholders, we also host other initiatives, including the Laboratory Community of Practice, which we have jointly created, jointly hosted, and jointly held several sessions in the preceding years as a platform created for ensuring and facilitating collaboration, bringing in opportunities for capacity building, and also knowledge sharing among health professionals and stakeholders. Following the successful implementation of this platform, it was also seen befitting that we expanded to cover other areas within the lab system strengthening that are a chronic problem within our community. This community of practice is being formulated following the discussion that we had during the special convention on diagnostics in Abidjan several weeks ago. This community of practice is being linked with the overall umbrella laboratory community of practice, and it will specifically target issues around genomic sequencing procurement and supply chain management, which were identified during that discussion as one of the bottlenecks in ensuring that we continue to build the needed structures, continue to build the needed infrastructure, and continue to strengthen genomic sequencing across the continent. We therefore would like to leverage on this successful laboratory community of practice, which has been a model of collaboration and capacity building. This community of practice that we are meeting for the first time today will focus specifically on addressing issues around procurement and supply chain challenges, which, as we discussed in Abidjan, is a critical aspect of enabling effective genomic sequencing as well as diagnostics in general across many programs within Africa. By integrating this initiative under the overall umbrella Lab CoP, we collectively aim to create those much needed synergies that will enhance the very important factor on sustainability, that will enhance scalability of genomic sequencing across the continent. This capacity, as you would agree, is much needed, especially in this era of ensuring that we are prepared for any public health emergencies. By ensuring that we have sustainable and scalable procurement systems, it enables us to ensure that there is uninterrupted access to genomic sequencing as a tool and as a resource for diagnostics in the continent. Therefore, it's very clear, it was very clear then, and I think it's still very clear in our minds now why we need this community of practice. It is once again through recognition of the challenges that many of us here, many of the countries face when it comes to procuring genomic sequencing equipment and reagents, as well as in managing their supply chain efficiently. These issues, unfortunately, often results in delays, often results in stockouts, and inefficiencies that unfortunately limit our ability to scale up genomic programs within the continent. This community of practice, therefore, will serve as a collaborative platform where all of you that are here and those that didn't manage to join today and all the other stakeholders can then unite to share knowledge, to address challenges, and most importantly, identify and implement practical solutions to ensure that we continue to expand and increase and strengthen our capacity for genomic sequencing. We strongly believe that this initiative will strengthen the key components that all of you and all of us are aware of when it comes to procurement and supply chain management systems, with the aim of ensuring that we continue to enable the scale-up of genomic sequences for diverse use cases that are becoming so useful, either in diagnostics, in surveillance, preparedness, and response, as well as ultimately improving the public health outcomes and patient care. With these few words, I would like to welcome you to this first genomic sequencing procurement and supply chain community of practice. And would like to thank all the partners, the stakeholders that are here, that have supported us in putting this together, and also continue to support us financially, technically, and otherwise to ensure that we continue to address the issues around procurement and supply chain in genomic sequence. Thank you very much, and I wish you a successful discussion today. Back to you, Dr. Johnson.
Thank you so much, Dr. Maruta. At this moment, allow me to invite Dr. Collins from Africa CDC to give his welcome remarks. Over to you, sir.
Yeah, so thank you so much, Johnson and Dr. Maruta, for that speech. So one question that has been asked regarding the why genomic sequencing is important in Africa. As we know, genomic sequencing has become an essential tool for improving the health, security, and enabling disease surveillance. It's not only improve the disease surveillance, but also strengthen the pandemic preparedness across Africa. So it allows us to detect and monitor the infectious disease, track variants, respond more effectively to public health threats, and also sequencing was an essential tool during the COVID-19 pandemic. And today, countries are using it to respond to the mpox. As we know, we have managed to use genomics to determine the variants that we are seeing within the continent. That is the clade 1A, clade 1B, and even clade 2 that we know we have really assisted us to map where it is within the continent. So Africa CDC envision a future where the use of genomic sequencing becomes a widely used and easily accessible tool for this purpose and more. The power of this technology, that is the sequencing technology across the continent, will enable much more effective and precise disease control and prevention for both patients and for the population. Now the question is, how can we link these with the procurement and the supply chain? Is it an important issue? Yes. We are currently facing a crisis while there is a number of barriers to sequencing. The most prominent of these is the procurement and the supply chain. Today, we are fighting Mpox and other outbreaks on the continent, but we cannot get the sequencing supplies we need to mount effective response. There is both immediate and long-term challenges in supply chain that we need to resolve. Right now, we need to address the very long-term, for very long-term times. It has taken for sequencing reagent to be delivered to a lab. It has taken a long-term time to deliver this sequencing reagent to the laboratories. In some cases, it can take months. Sorry. It can take months, or even in some cases can take even 1 year, depending on the system within in a given country. So we need to address deeper structural issues related to high cost of reagent, commodities, complexity of buying the sequencing supplies, and the lack of market clarity and coordination amongst the buyers. So reaffirming this commitment to support the COP effort and call for action, Africa CDC is committed to supporting priorities and activities of this community of practice. This community has to be action-oriented group. We can no longer let the supply chain challenge to hamper our disease control effort. This initiative aligns perfectly with our calls at Africa CDC to enhance the collaboration and capacity across the continent to solve the difficult problems that we are currently facing. So I'd like to thank everyone for participating in this inaugural COP and bringing your respective skills and capacities to join us in strengthening sequencing capacity and addressing these supply chain challenges. So I'd like to welcome everyone, and I know the discussion that it will come from this initial or the inaugural genomics sequencing, procurement, and supply chain community of practice will really enable us to solve the problem that we have been facing in the supply chain. So with that, I'd like to say thank you, and we are here to contribute to the discussion. Over to you, Johnson.
Thank you very much, Dr. Collins. Today we have a packed agenda, and allow me to do a quick rundown of the agenda items. We shall have the COP vision, objectives, and structure being articulated by Mr. Shumba from ASLM, and then the reflections mainly from the key takeaways from Addis and Abidjan sessions shall be done by Dr. Sarah from Africa CDC, and the next roadmap will be done from Dr. Sarah as well. Then near-term priorities and the progress to date, Edwin shall take us through that. And we shall have also an interactive discussion for all of us, where we shall ventilate issues around procurement and supply chain management. And we shall then wind with a recap and the next steps. And at that moment, we'll be near the end of our meeting. So allow me to invite Mr. Shumba. Over to you.
Thank you very much, Dr. Shone, for this opportunity. And thank you, Dr. Tanui and Dr. Maruta, for setting the stage for us. As you highlighted in your opening remarks, this is a very exciting moment for all of us, where we are having our first session of this community of practice, which is co-hosted by ASLM and Africa CDC. As you will recognize, the Secretariat is led by ASLM, and we are responsible for the administration, setting the priorities, as well as the stakeholder engagement to make sure that this COP is a success. So to quickly take you through the vision and objectives of this CoP, we seek to create a platform that's going to help strengthen genomic sequencing procurement and supply chain management on the continent so that we can provide a service that is timely, cost-effective, and provide quality resources to the labs that are providing this service. So now looking at the key objectives that we have for this CoP, we want then to advance priority interventions on the continent so that we can address those challenges that we have been facing, as well as ensure that we share knowledge and best practices on how to use genomics. Sustainability is also at the core of what we envision for this community of practice. We want to ensure supply chain efficiency in a sustainable manner. We want to also provide that platform where we discuss and address the real issues that impact supply, as well as the use of genomic sequencing on the continent. And as we are well aware that ASLM is a convener, we want then to coordinate and align all the initiatives that are ongoing on genomics, as well as procurement and supply chain on the continent. So this, as Dr. Maruta highlighted in his opening remarks, is not like a standalone CoP, but this is coming to support the already existing lab CoP, which seeks to strengthen lab systems. And this particular supply chain CoP for genomic sequencing is just but one of the subcomponents of this bigger community of practice. So who are going to be the members of this? So we have had engagements, interactions, as highlighted by Dr. Tanui in Senegal, in Addis Ababa since 2023 in February, and we brought together procurement professionals, ASLM, representatives from funding agencies, researchers, as well as academics and subject matter experts. So this CoP is open to all genomics and procurement, supply chain management stakeholders on the continent, as well as experts to join. So how have we envisioned the governance of this particular CoP? We have a steering committee that is led by ASLM, which has a sole responsibility of overseeing the strategy, the administration, setting priorities, as well as leading the stakeholder engagement to ensure that all the activities we do on this CoP, they are in alignment with the country needs. Secondly, we will be establishing different time-bound subgroups that are going to be deliverable focused, as we are all aware that the situation is very dynamic. So we will be addressing the challenges as we go, and we will be having that coordination through a coordinator at ASLM, responsible for organizing the different meetings, the webinars, as well as tracking the outcomes for this particular sub-CoP. Indeed, there's going to be a lot of sharing of knowledge, and we have established 4 mechanisms to help us share this knowledge. The first one being having a platform for discussions, document sharing, as well as real-time collaboration. So we'll be sharing more details in the coming weeks. We will be having this kind of webinars every 6 weeks, as well as we are envisioning an annual meeting where we continue to engage and share knowledge. We are also establishing a central repository for all these different documents that we will be developing and sharing, which include your policies, case studies, as well as some of the papers that we'll be writing. To cap it up, we have also onboarded a mentorship and peer learning arrangement to make sure that we leverage on the expertise that is available on the continent. So to measure the progress and the good work that we'll be doing on this CoP, we've set some basic key performance indicators that we'll be tracking, stakeholder engagement, which is very, very key. We want to ensure that we engage the different stakeholders on the continent. So we'll be tracking that. The shared savings, which I think is very key, as most of the consumables, equipments that we use are very costly. So cost reduction is quite key. The issues around lead times and stockouts, as highlighted earlier, we'll definitely be tracking that as well. The number of resources that we create and share on this community of practice, because we say this is a platform for us to be sharing all these resources, as well as the uptake of new technologies and practices during the life of this CoP. So these are some of the key performance indicators that we'll be monitoring as we implement this CoP. With that, I want to invite Dr. Sarah to take us through the takeaways. Over to you, Dr. Johnson.
Thank you so much, Mr. Shumba, for articulating the CoP vision and objectives so clear. Let me invite Dr. Sarah to then take us through the key takeaways. Over.
So thank you very much to my preceding presenters for at least setting the stage. And what I'm trying to do right now is to sort of take us backwards as to how we got ourselves into having these discussions, and exactly, how we were able to unearth these problems, what kind of engagements we've had, and how we see it moving forward. Next slide, please. Yeah. So, I'd probably say it's not necessarily that it's reflections from the, Addis Ababa and Abidjan sessions. These sessions were actually done this year, but the initial engagement was actually done in Dakar in last year in February. And of course, stemming from the lessons that we had learned as we tried to implement a continental genomic surveillance program during the COVID-19 pandemic, and seeing now how we were going to leverage that to move forward to other use cases. And what you're seeing here is just an appreciation of the public health decision-making that starts from the specimen collection, from biobanking, and then goes to the laboratory, where then the testing happens, and there's genomic sequencing, and then from then on, the data is generated that then is used to feed into the public health decision-making. So you see all these components feeding into each other, and this, of course, if there's weaknesses in any of the three components, then that means the system is not efficient. So this is what some of the issues that some of the issues stemmed from this as we're trying to implement the continental genomic surveillance program. Over, next, thank you. And really, what lessons did we learn in terms of the procurement and supply chain management? The data you are seeing here is just pertaining to what was done between 2020 and 2023. You see us working on various use cases, not only COVID-19, escalating that to Ebola and Mpox, and even Marburg. Acquiring a lot of equipment, 70% of the equipment that we did donate to that we took, or rather we placed to the member states, was through procurement, and 30 of that using donation. And in terms of the reagents, 50% procurement, 50% donation. And of course, I think the sheer numbers, and not only then, even beyond COVID-19, just shows, there's a lot of lessons that we learned as trying to implement the supply chain. And I think, as we all know, medical supply chain are complex. And in the case of genomic surveillance, a lot of factors involved in thinking about the surge and drop in global demand for equipment and reagents. So the demand management is an issue. Shipping reagents in ambient conditions. So some of the airlines do not accept that. And then you also have the issue of equipment and reagent, or rather inventory control. Most of the labs are not digitalized, and you find that most of these products have a short shelf life. Also, the issue of the procurement management itself, the digitalization aspect that is not And of course, there's also the genomic surveillance. You have to do the sample collection first, which has its own component, has its own reagents and consumables needed. Then the molecular components, different kind of suppliers. Some supply on time and others don't do that, don't do it on time. Then of course, that leads to longer lead time. And Also the issue of monopoly, currently not very dead, so we cannot call it a monopoly per se, but the more players there would be in the manufacturing space, then the more options the consumers would have. So really trying to assess, is this really a good or a bad thing in the long term? Next slide, please. Yeah, so so I think during the implementation, these are some of the challenges that we would say that were teething at that point. And the first one being the heterogeneous regulatory landscape. Some equipment could get into some countries seamlessly, and then with others, there's a lot of other layers of documentation that had to be done and approvals for them to go there. The issues of extended lead times. There was also the issue of paucity of channel partners in the continent at that time, because this was scaling up at the time of a pandemic, and also the manufacturers trying to find their space in the African continent. And of course, if you couple all this, then it leads to the issue of costs, which then makes it very expensive, especially on a small scale. And also there was the issue of the local technical capacity workforce, which was quite limited. And of course, we say every challenge brings its opportunities. We see that as how we can now leverage on our capacities or sessions that, on the stakeholder capacity and the negotiation, so that we can be able to improve on that. I think what the question we're asking ourselves at that time is how we can leverage the lessons learned to optimize the supply chain for molecular diagnostics and genomic surveillance. Next slide, please. And that's when we convened the first meeting, which was in Dakar in February of last year, calling it the Workshop on Optimization of Supply Chain for Genomic Surveillance. And the key takeaways from this particular meeting, a lot of solutions put forward, very good engagements between the end users, the manufacturers themselves, some of the channel partners, and we as Africa CDC and ASLM as the coordinators. So we did put all these things in an SNHOA matrix, probably seeing what is it that we can be able to do within the short term, those ones that can be done in the medium term, and those are in the long term. And you can see the solutions that were proposed in the matrix as here in front of you. And the issue of forecasting and capacity development, becoming some of the top things that can be done, and already will have a high impact in the short terms. And also things like courier services and customs officials being sensitive about cold chain, developments of technical working group, and of course things like mapping the landscape of the regulatory landscape. So those are things that were could be implemented immediately. And then we then followed that up with another workshop that happened in July of this year. CoPlanned together with FIND and ASLM, we called it the Workshop of Future Fit Genomic Sequencing, Procurement, and Supply Chain. So at this point, we had the team from FIND together with a consultant doing some mapping in the 2 countries, in Nigeria and Mozambique, and trying to see what kind of problems were still, beyond the COVID, and the kind of persistent problems that were there. Please, next slide, please. Next slide, please. Yeah. So what you realize is there's not so much between what was, please go to the previous slide. Yeah. So if you look at the kind of problems that were also identified, still the same problems that we had identified during the pandemic. And what was interesting about this particular workshop now is we had to come up with solutions and some kind of a work plan in how we are going to actually implement this optimization of the supply chain. And as you can see, these are the 3 main areas: standardizing fit for purpose service and maintenance for low and middle income countries, strengthening the procurement capacity, and also streamlining the regulatory environment. So under each one of these proposed solutions to the problems that we had identified, then we came up with a list of strategies or what could be done. But I think what is most important is for us to differentiate at this point now, what is it that is within our limit and what is it that will take a much longer time to implement. Yeah. So what we decided to come up is to use the results of this particular workshop. Key challenges are identified. So a set of solutions were identified, and the general consensus is that now this can be put into action, and these have been put into a roadmap for advocacy notes and technical guidance and materials to raise awareness. There's also the issue of strengthening the procurement capacity, which can be achieved by introducing the best practices and approaches, such as all-inclusive pricing and locally manufactured laboratory commodities for genomic sequencing. And then there's also the issue of the improved service level agreements, which will focus on standardizing service level agreements to increase the percentage of active instruments covered by the services. There's also the issue of the streamlined regulatory environment. So with this one is really trying to reduce the unnecessary barriers, which of course then lead to the increased cost and getting delays in getting the equipment and reagents to the labs on time. And I think also making a case for genomic sequencing, an investment case, mobilizing investment by governments and partners in genomic sequencing as a powerful tool with multiple uses across the public health space. Next slide, please. Yeah, so we've come up with what you're seeing there is more like what I would call a high-level roadmap. It's what I presented in the previous slide. What are the kind of solutions that we are putting forward, and what is the difficulty scale of implementations? So you see the issue of the tool adoption and standardization, and also every other thing that can be done within the space. So that roadmap is a strategic one. It will drive the progress, but we have to say it's a living plan, and it will be changed as and adapted as needed. Over to you, Edwin.
Great. Thank you so much, Sarah, for that run through, sharing with us the proposed way forward. So what have we achieved to date? So a lot has been going in the background. So we have managed to work on some advocacy notes that we have developed, 4 of them that focus on minimum requirements for service level agreements, harmonizing the regulatory environment. Another one that takes a deeper dive on duty-free waivers, as well as multi-country forecasting. We have also been working in the background with a tool that has been piloted in 2 countries, Nigeria and Mozambique, as highlighted, which helps us with the mapping genomic sequencing capacity within countries. And we want then, in the discussions that will come later, be able then to deploy and roll out this tool to help us map that capacity. We had that launch of the community of practice in Abidjan in November in Ivory Coast, and that was a great opportunity which laid the foundation for this first session that we are having of this CoP. Also, there have been some discussions that have been going on where there was a panel discussion that was held at the Global Health Supply Chain Conference in Nigeria in November, of which Dr. Trevor Peter from CHAI moderated, where we had some interesting discussions. So where does that take us? We have proposed some priority actions for the next few months. So we want them to share these and have some discussions as highlighted by Dr. Johnson. So immediately, I think, as Dr. Tanui highlighted, that we are having issues with response to MPOS. We have observed that there is delayed delivery of the sequencing products. So as Africa CDC, CHI, ASLM, we want then to immediately address some of those bottlenecks that we have observed in the delivery of emergency sequencing products. We want to continue with the advocacy notes to ensure that we then disseminate these 4 that have been drafted with the support of ASLM, Africa CDC, and all the other key stakeholders. The strengthening of procurement capacity is something that we are seized with, and we want to continue supporting multi-country forecasting. We want to also expand the tool that has been developed, which is the install base. We want then to also engage in price transparency discussions, as well as ensure that there is consistency in the ceiling of prices, reagents. So all these, we are going to be engaging all the relevant stakeholders to make this dream a reality. Additionally, we will want to continue developing some guidance documents as part of the way forward that we are proposing, and we will be working collaboratively with FIND, CHI, ASLM, and Africa CDC. The transition to the utilization of alternative pathways for procurement, I think, is something very key that we are also proposing. We also want to streamline the regulatory environment by also engaging member states to also enlist as part of their essential diagnostic lists genomic sequencing products. So an engagement with the country lab directors is very key. So we will be reaching out to all this. And as well, we want to continue building capacity on the continent. So we propose that we will be drafting a proposal to establish that capacity building program on the continent. So all these SMEs that are with us today and that we continue to engage with, we will be reaching out to them for inputs into all this. So with that, I want to hand over back to Dr. Johnson to lead us in the discussions. Over to you, Dr. Johnson.
Thank you so much, Mr. Shumba. Thank you very much. So I think at this moment, we are now at an open discussion. I think as alluded earlier, we have taken a multifaceted approach to deliberately involve as many stakeholders as possible, ranging from our manufacturers who are also here present. We are also including our funding partners or donors. We have also representation from countries to give also their perspectives. So I think at this moment, allow me to invite first Bridget from Illumina to then talk about some of the innovations they've done or developed from the manufacturer's point of view, and to try to address some of the critical procurement and supply chain issues we have had. After Bridget, we also hear from the country teams, and after that, we are going to have an open forum from the rest of the team members to then chime in and also throw in their suggestions or their opinions. Over to you, Bridget.
Right, Johnson, thank you so much for really mindless comments, right? This is a good initiative that will really drive the adoption of genomics in the continent. And I'm very excited and thankful for ASLM and all the partners to having shared this initiative. I was saying earlier to someone that there really is no need any longer for Africa to take decades in ensuring that Africa catches up to the rest of the world in adopting innovation. And I'm very thankful for your leadership. From an Illumina perspective, we are committed to partner with the rest of you. Nothing pains us to go to a lab and find that, you know, the sequencers are sitting there because they've been procured and other items are missing and expiry date. And that is why we are very excited that we've launched. Many of you have joined our launch, but please look out for this launch in the next couple of months as we launch our new MySick, which to this point, I think it's our North Star as the Africa Illumina team. In terms of bringing this innovation where we no longer need, we're shipping with ambient temperature, not only ship, but also store. So we're very excited to bring this innovation. I was saying to Marge, I think at the last meeting in Addis, that, just getting hold of dry ice, the procurement, and the holding and storage of cold chain is very, very challenging for Africa. And as Illumina, we're very excited. And I think I'll leave it here. Thank you.
Thank you so much, Bridget. I think we've heard the good innovation from Illumina. I think it's the part is part of the collaboration that we've spoke about, which will continue to enhance the efficiency of the supply chain. At this moment, it's my pleasure actually to invite Simon Harris from BMGF. So Simon, maybe the audience would want to know from the way you stand what you may consider the most urgent actions needed to address genomic sequencing and supply chain management issues. How do you think donors can help in this space?
Thanks, Johnson. I think the most urgent is a difficult question. We've been working with many on this call for a number of years now to look at the landscape and where the challenges lie. And really what we found is that there are challenges at all steps of the procurement and supply chain process, as Sarah so nicely showed in her meeting, in her presentation. So I think that from our perspective and the perspective of funders, we need support from a community of practice just like this to work with stakeholders across the community to really identify where we can support best and where we can make the biggest impact quickly, but also for the longer sustainable term. I think one thing that's really important for me is that as genomics has expanded so rapidly across Africa and other lower middle income countries, it's really important that we now, as a community of funders, need to address these issues of supply chain and procurement rather than just keep talking about the problems and looking for workarounds. And it's really not just an opportunity to build the genomics community further and take advantage of the capacity, which is something we should certainly continue to do. But we need to think about how we can very intentionally support investments in this space. And be very mindful of the challenges that are faced by our grantees, because they're very different than many funders may have come across before, and we need to be very equitable and ethical about how we think about investments as well as how we work on them. I should say that there is within the funding community still pressure on us as funders to deliver quickly, and there's this view that we need to get results and get data quickly to show that genomics is valuable. But so we need to balance that against these questions of how we look at the long term. And we need to move away from short-term solutions and workarounds and start to really think about how we can engage experts in the space and learn from areas such as diagnostics that have already faced some of these challenges and made really big steps forward. So I think it's important almost for the funders to change their view of how to fund in this space, not only shifting genomics more locally, but thinking about how to support that more broadly. And just to end, one thing that I think is good is that recently Wellcome and the Gates Foundation have been working to develop a funders forum for pathogen genomics, and that's kicking off very shortly. And during the landscaping process, where we were talking to funders about their interest in a funders forum, we also spoke to them about areas that they feel that they're hearing are the biggest challenges for genomics, and also that they would like to support but perhaps don't have currently the investments or the expertise. And the one that kept coming up at top of the list was always procurement and supply chain. So I think there's an opportunity there, and a definite appetite from the funding community to try and understand how they can start supporting this aspect of genomics so that we can really push genomics to the next level.
Thank you, Simon. Thank you so much, Simon, for the valuable input and support that you have mentioned from our donors' perspective. Thank you so much. I think maybe at this moment, I will also invite Pragati to speak to a few issues. There was a wonderful PSM based tool that was developed and installed to map genomic sequencing infrastructure across the countries. From the way you see it, how do you envision advancing this tool to other countries to enhance the procurement supply chain management components across the continent?
Thanks, Johnson. So this tool basically was developed for two countries, right? Mozambique and Nigeria. And once this tool is taken over by ASLM, I look towards its expansion to include data from different countries and labs. And so eventually, as more countries start feeding their information, we are looking at a very powerful database, which is going to give insights on install base, the operational function of these equipment, what is the SLA coverage for these equipment, and the programmatic focus area. And therefore, these insights become very relevant for decision makers at the lab level and at the country level to identify gaps and empower them for an informed decision making regarding infrastructure investments and resource allocation. I also think that once you have this tool up and running, which is being used actively by different stakeholders, you can also eventually start adding different metrics into the tool. For example, one of the metric could be like equipment utilization. And so that would support decision-making around, say, optimized network for genomic sequencing within a country or within a particular region. And that leads to eventually improved procurement and supply chain practices as well. Yeah.
Thank you so much for that great input that you have just contributed to us. Maybe because of our time, maybe allow me to then check if we do have at this moment Dr. Musa from Senegal, or Dr. Isaac also to give also some of the experience which they may want to share, which they have implemented in their respective countries. And they would think that it's a practice that can be replicated elsewhere as a best practice. So let me check if we do have Dr. Isaac or Dr. Musa.
Alison will speak on behalf of Dr. Isaac. Maybe Alison.
Okay, thank you. Over to you, Alison.
Yeah, thank you very much. Confirm if you can hear me.
Loud and clear, thank you.
Yeah, I think in terms of supply chain for genomics in Uganda, and particularly at Central Public Health Labs, we grappling with the same issues that are highlighted, and the team here, I think, is making efforts to solve across the continent. But some of the lessons that we have learned over time, I think we have been emphasizing and overly emphasizing the importance of creating or supporting local distributorship within the member states. And particularly that has been one of our strengths, because earlier on, for example, I'll give an example of Illumina reagents. We only could get this support from Dubai. The servicing machines would come once in a year. But now that we have the teams on ground, they can be able to support us anytime we want. They're just a call away. And procurement of reagents is much easier. At least we have now a 3-week turnaround time. We ordered an equipment, a MySec, one time, and it took only 4 weeks. And that's because there is local teams on ground to support us. But this has not come easy, and we've been advocating to Illumina, because the business in the member states needs to make sense in an economic point of view. And that's why, unlike most companies that the models don't work, we have been advocating that for every business that is Illumina related, for as long as it's channeled to the member state, can the local partners have visibility of it. How is it important to us is that, one, they are quick to support. After sales services is given in time, and they see a reason why they should extend the cost reduction that Illumina has given to the individual customers. But we see this is only applying to Illumina, and we want this to be expanded to other companies. Other companies, you find that they have multiple distributors within a certain country. That makes it hard. Two, there's no control of the pricing. So if Illumina gives me a kit at 1,000 and the markup for the company, it's agreed upon between Illumina and the company and the local partner. But for some, there is not much control. I know there is the Global Access Initiative where we can do these things, we can get these prices directly, but still some of the member state institutions don't have the capacity for clearing, forwarding, and all those things at customs. But if we get this support through the local distributorship directly on my door at the same price, subsidized price, I think that makes sense. I think for us, the journey of advocating for a local distributor and making sure that there is visibility for any business that comes into the country, whether it is procured locally by us or whether it's procured by our partners, let's say Global Fund, Africa CDC, World Bank, we always make sure they are within the loop of the discussion, such that at the end of the day, if we need support, we get it timely. Thank you very much.
No, thank you so much, Alison, for the wonderful contribution of your experience from Uganda. I think there's a good comment from Felix in the chat box, I think showing willingness to participate in the mentorship program, which is a wonderful comment, actually. I just thought of acknowledging that. So if we have more comments or any questions, I think let's feel free to utilize the chat box. We will be visiting or checking on that. So let me take a minute or two to invite Olusalo from Nigeria to share their experiences from that end for the whole team to benefit. Over to you. Hello, Olusalo, can you hear me? I want to believe maybe there may be some few tech issues that may be affecting to come in. But I think at this moment, we may want to open the floor to everyone. Any comment one wants to share, any contribution, I think that's the time to hear from all of us. I think there's also a question in the chat box. What would be the mechanism for addressing the supply chain challenges for monkeypox? How should the participants expect to contribute? I think that's a question. Let me allow the team to respond to this question. Thank you, Mayor, for the question.
Thank you, Johnson, and thanks, May, for that very pertinent question, because it's speaking to what is happening right away. So as some of you may be aware that we have a communication platform that we have been using since the meeting in Addis Ababa. So feel free to share some of those solutions with Dr. Sarah at Africa CDC or myself at ASLM Edwin. I'm going to put the email addresses on the chat box so that you can then possibly just share with us some of the challenges you are facing, and then we can reach out to you to work out how to go around some of those challenges. So I think for now, we can use those two platforms to be able to channel some of those challenges over.
Thank you very much, Mr. Shumba. Let me check one more time if there's any further comments or question from this team. It looks like there are no further comments or question from the team.
Dr. Johnson,
yes.
there's a
Trevor,
hand
yes.
from Trevor.
Yes, thanks so much. Trevor, please chime in. Hi, Trevor, please go ahead. I think if you are speaking, you're on mute.
Actually, it's on mute.
Yes,
Thank you.
we can hear you now.
Actually, I think some of the participants needed to be unmuted to allow them to speak, so maybe contributing to the quieter times. I think Maeve raises a very important question about how do we mobilize quickly to address the supply chain challenges for sequencing for mpox. And from my perspective, this is really a community effort that requires the work of many of the people on this call, suppliers, and buyers, and labs, and so on. From what I can tell, there are some real challenges, often within country, related to the importation and customs clearance. Duty-free certificates seem to be a real challenge right now. And the solution for this, I think, will vary from country to country. But the point I wanted to make is I think we should try to zero in on the specific steps that are holding up supplies or orders that are currently happening and are currently pending and waiting to arrive in country, and try and solve them sort of one by one. And I think for that, it would be helpful if this community could take steps to share what we know, what we know as a group about orders that are being placed for mpox sequencing, as a first step to sort of creating greater visibility around the procurement. I think many of the labs and groups in this core often, do procurement maybe individually and on their own, and so suffer with some of the supply chain challenges by themselves. I think this community allows us to come together and to share what procurement is currently happening. So I know that Africa CDC will be establishing an observatory for Mpox sequencing supplies to match its tracking of other Mpox-related commodities and products. And I think, having that as a starting point would be very important. And then this community sort of really keeping track of what orders are coming in, and then trying to really zero in to solve those nitty-gritty problems, whether they're at an international level or at a national level, is probably the way to go. Over. Thank you.
Thanks so much, Trevor, for the great input from you. We truly appreciate the perspective that you have added to this conversation. I think there are some good points from the chat box from Maeve and Bridget. I think there are issues that are also spelled out under the key components of the roadmap. I think we will touch that in a moment. So I think because of our time, let me just check one more time if there is any further comment from the team before we can do the recap and the next steps. It looks like we are good. So maybe allow me to do a recap of what we have discussed today. Genomic sequencing, procurement, supply chain management, conduct of practice is indeed a product of an extensive collaboration and consultation done through a multifaceted approach involving a number of participants or players, as we have seen even today, or even in the other meetings prior. And procurement supply chain remains a key driver of performance in genomic sequencing. Hence, I think the need or the recognition that we all need to put our hands together and try to find workable solutions. Yes, we have challenges that we spelled out clearly in the presentations, but our focus, our deliberate focus, is on the solutions that are Africa-oriented and able to deal decisively with those challenges. And in terms of the roadmap that was clearly explained, touching on advocacy, strengthening of the procurement capacity, the streamlined regulatory environment, very important components of it, the capacity building in terms of procurement, the service level agreements, and also investment case for genomic sequencing. So I think at this moment, allow me to invite Dr. Collins to do the closing remarks.
Yeah, so thank you so much, Johnson. I'd like to thank all of you for your valuable contribution today. We are confident that the discussion we have had will pave the way for meaningful progress in this field of the community of practice, especially the supply chain. And the commitment expressed by all demonstrate our collective resolve to address the challenges ahead. So together we will contribute to build the momentum and work collaboratively towards the achieving our shared goals. So we look forward to the next step and seeing the impact of our combined effort. And once again, I'd like to say thank you. And I know in the next call, we will have more deliberation. Otherwise, thank you so much, Johnson. Over to you, Johnson.
Thank you, Dr. Collins. Maybe I just want to take the opportunity to thank everyone for attending this important session and for the interaction that we have here. Enjoy the remaining part of your day. Thank you so much. Merci beaucoup.
Thank you. Thank you.
Bye.